Hey, so thank you so much. Thanks all for coming. I'm just looking at the results of the poll here. So, oh, can you all hear me? Yeah, great. So just seeing how confident you are in this topic, I think the majority is neutral, falling, but somewhat not confident. So hopefully you're gonna get more confidence towards the end. And we are organizing this session. Then we start with a presentation between all members of our teams. And then we later on, we're going to have time for questions, like 10 minutes questions. If you want to pop some questions on the chat, it's fine. If you want also to open your microphone and tell us what is your question, is also fine. Then we're going to hope to have like a 10 minutes break and come back for some discussions. So Katie is organizing some breakout rooms for us. So we're going to have 3 breakout rooms, which is going to have different topics about screen behavior in earlier settings, about the new guidelines, and about the parents use and the transition of this screen to school, how important it is to have children skill on these screens, on use of tablets and small smartphone at early age to get them ready to school. So that's going to be like about 15 minutes, 20 minutes discussion, and then we join everyone again in a big group to see what everybody learned on that group and exchange some experience, and then we close. We'll be happy to share the slides with you towards the end. We also could send you our website and any other information that we can help you, maybe if you want to promote our study in your earlier settings, or if you live close to Sheffield, where we are, that would be great. So yeah, so I'm going to ask Amy, who is going to be doing this slide sharing, so I can start the presentation. Yeah, so it's great. So this is the team that is presenting today. So it's myself, I am the principal investigator of the project. Then you have Colette Marr and Amy Hughes, who are the research fellows and trial managers of the project. Ellie Gray, who lead the work package 3, she's going to tell you all about it. And then Emma, who is our research assistant. We also have Rachel Stamper, who is also here. She's going to help on the group facilitation later on. So next slide. Okay, it's probably like every week that you heard something on the media about the use of social media by teenagers and the policies in schools to ban cell phones in school, the idea that social media will be banned for children under 16, also the prosecutions that are going in America against Meta and other companies because of use of social media and regarding addiction. But not much until very recently has been said about the use of the device for early years. So it was about February this year that the Department for the Education mentioned that they would be releasing screen guidelines for young children. So next slide. So in March, they released the guidelines. I'm not sure how many of you are familiar with these guidelines that was released just recently. They've made some promotion throughout the media. We are doing quite a lot of testings in earlier settings, and I can see lots of earlier settings are having posters with the guidelines at the front door. So it's becoming, I think, more familiar to most of the people. They are disseminating, I think, quite well at the moment, but you like to hear from you later on if you have heard or not about these guidelines. So the guidelines say that in terms of duration of screen time, and screen time here is not just tablets and smartphones, also involve TV viewing. They suggest that for children under 2 years old, they should avoid screen time altogether, so no screen time at all. And from children from 2 to 5, they recommend about 1 hour a day, but avoid meal times and in an hour before bedtime. This is exactly the same as the guidelines that was released by the World Health Organization in 2019. So not much change regarding screen time for early years that was brought from the Department of Education. However, they mentioned a few new things that was not in the World Health Organization guidelines. They mentioned the importance of content. So they said that children should choose slow-paced, age-appropriate content and avoid fast-paced social media style videos and toys. So I presume that fast-paced video might be like TikTok and the short YouTube videos that they have. It's not very clear. I would say that the evidence in this area is still building up. I don't think there is much yet, but the Department of Education thought it was important to highlight the importance of content and not just the duration. They also mentioned the importance of co-viewing at this age. So children should watch the device with their parents and try to engage in conversations to promote development. And this is something that has been some evidence in the literature, because the fact that children are isolated using the device, that might affect their social development and the communication skills. So co-viewing is better than watching the device by themselves. So next slide. So it is a very prevalent behavior in early years. Children and parents, according to Ofcom, from a report that they produced in 2023, children 3 to 4 years old, 75% use tablets and 41% use mobile phone. Only 13% do not go online. I'll be very keen to hear from Ofcom maybe in 1 or 2 years' time after the release of these Department for Education guidelines, if there was a drop in use of devices or going online. It will be interesting to see if the guidelines is producing an impact or not. In the United States, I have something similar to Ofcom that called Common Sense Media, and they produce a report for children 0 to 8 years old. And according to their survey, children at this age spend on average almost 3 hours on tablets. And I think one stuff that got my attention on this report is that children from low income tend to use twice the duration of the device comparing to children from high income. So this is probably like a huge inequality in terms of screen time. So probably children from low income have less opportunity for other activities and spend more time in screen compared to children from high income. And it will be interesting to see what are the consequences for their development of this high exposure to screen behavior. Next slide. So what we know so far in terms of the negative effect and possibly the positive effect of impact of devices on young children. So there is quite strong evidence that the use of the device can increase the high risk of myopia in children, poor sleep quality, particularly if children watch the device 2 hours before going to bed, some behavioral issues, low academic performance, low social emotional challenge, and also motor proficiency. However, if it can be used in a learning context, it might improve receptive language, literacy and numeracy, manual dexterity, and visual spatial memory. Next. Okay, one thing that the report the Department of Education mentioned, but it doesn't emphasize much, is the importance of parent use of the device and how this is affecting children development. There is kind of a lot of evidence building this aspect, what they call technofluence. So the impact of technofluence on parent and child interaction. When parents are on their phone, they engage in fewer verbal and non-verbal interaction with their children. They also they may respond to their children's requests for attention with increased harshness and decreased warmth. And also parents' use of the device as being negatively associated with children's vocabulary, grammar, emotional behavior, and self-regulation. So I think there is a need to focus more on parents' use of the device also, particularly at this age, which is different from the teenager age. That's why I think it's important to separate this area of research and focus in early years that have different needs than a teenager group. Next slide. So this is a study that I conducted before we received this grant from the NIHR to do the iKID studies that we're going to talk throughout the presentation. I did a kind of a consultation, a qualitative study with earliest practitioners and public health consultants to understand what are their views about the use of interactive electronic device in young children. So earliest practitioners and public health consultants reported that they know that these devices are used for children to entertain them while their parents are busy doing their work or home chores. They think that it impacts on communication and behavior. They have seen changes in children communication and behavior. They said that, of course, there was COVID that accentuated the problem, but they said that sometimes this problem came before COVID. They also said, however, that it can be some benefits for learning. So sometimes if they are looking for some resources, they might use a tablet to illustrate things for children where they want to try to teach something. They also think that there is a need for parents and earliest practitioners to learn more about what are the impact and develop interventions. So here I have two quotes, one for earliest practitioners. One, she is expressing her frustration when parents come to collect a child, that they don't interact with the child or with the children. Instead, they interact with their phone. So just reflecting how parents are also very addicted to their phone. Another actually mentioned something different. She said that it could maybe be beneficial for some children with special education needs, because she said that they have learned a little bit more vocabulary. If you use in an appropriate way, it could be beneficial. So this gave us some ideas to develop this project. So I'll pass to my colleague Colette, who is going to introduce the project and tell you more about the first work package of the study. Thank you.
Thanks, Liani. So like Liani says, I'm going to tell you about the iKID study. I'm going to give you a little overview of the three projects that we're doing in the study, and then I'm going to talk about the first project, and then Amy's going to talk about the second, and Ellie is going to talk about the third. Next slide, please, Amy. So the iKID study is comprised of three work packages. The first work package, its aim is to summarise the evidence on the determinant of tablet and smartphone use in children under 6. So looking at the factors associated with children's use. This work package has actually been completed, and I'm going to talk you through the results of this in a moment. The second work package is a longitudinal study where we look at children aged 3 and then follow them to age 4 to determine the long-term impact of young children's tablet and smartphone use on their health and development. This is a really big study and it's currently in progress, and Amy's going to tell you more about this one. And then the third work package is an ethnographic study with interviews with parents of young children. And this is so that we can understand the context and interactions around children's use of tablets and smartphones at home. And Ellie's going to present some preliminary findings from this later. So all three work packages are designed to provide further evidence to support national and international guidance on the use of children's of young children's tablet and smartphone use. And this is the hope that in the end we can kind of inform the development of an intervention to reduce tablet and smartphone use for children in this age. Next slide, please, Amy. So I'm now going to present some findings from the first work package, and this is where we summarised all the evidence on the correlates or kind of factors associated with tablet and smartphone use in young children. Next slide, please. So it's really important that we know what drives usage patterns in young children. So finding out who is using tablets and smartphones the most, because obviously this can then help inform intervention design and guide future research and kind of really help us to kind of target the right people who are using tablets and smartphones the most. So to answer this question, we conducted a systematic review and meta-analysis where we pooled all the evidence available on the correlates of young children's use of tablets and smartphones. So we looked at all the studies that have been published, which have looked at the different factors related to children's device use and kind of brought all this together into one paper. Next slide, please. So overall, we found that there are 99 correlates that have been explored in the literature related to the time that children spend on tablets and smartphones. And we synthesize these correlates according to 3 levels of the socio-ecological model of health. So the individual level, so this is things such as age, gender, and then there's also an interpersonal level, which is things such as the presence of siblings, parental rules, and then also the environmental level, such as access to places for physical activity, for example. Next slide, please. So here's the array of correlates identified. So there's quite a lot. So a lot of things have been explored in the literature, but you can see that most of the kind of factors that have been explored are actually around the individual level and the interpersonal level, and very few have been explored at the environmental level. I'm going to look at these a bit closer in the next slide. So Amy, next slide, please. So looking close at the kind of individual level factors that are related to children's tablet and smartphone use, the things that have been explored include age, sex, BMI, so kind of around child demographics. And then there's also been ones around kind of child behavior and development, such as watching TV, whether the child met their motor skills milestones or language milestones, and also child temperamental traits. So many of these factors have only been explored in 1 or 2 studies that have been published. Or if they have been explored in 3 or more studies, the results have actually often been inconsistent. So the only thing is that the length of time children watch TV was identified as a positive correlation in more than 3 studies. So this suggests that children who watch TV for longer are more likely to spend a longer time on tablets and smartphones. Next slide, please. Looking at the interpersonal correlates identified in the literature, these included factors around family characteristics and structure, so parental age, parental income, presence of siblings, and it also included things around family rules and behavior, such as parental device use, parental depression, and parental attitudes. Again, many of these factors have only been explored in less than 3 studies, or if they have been explored in more than 3 studies, there's inconsistent results across those studies. But what's really notable here is that parental device use was found to be a strong positive correlate in predicting children's device use. So this suggests that the longer parents spend on the devices, the longer their children will spend on their tablets and smartphones too. Next slide, please. And finally, some studies looked at the kind of environmental factors around children's device use, specifically around neighbourhood quality, such as the traffic level in the neighbourhood or the crime rates, as well as the environment for physical activity or walking. However, very few studies have actually looked at these environmental factors, and therefore we cannot say how significant they are in shaping children's use of tablets and smartphones. Next slide, please. So finally, we also conducted a meta-analysis. So this is something which strengthens the findings of the systematic review by applying statistical techniques to examine them in greater depth. And when we did this, we found that boys, older children, parents with high levels of device use, and parents with high levels of stress were more likely to use tablets and smartphones for longer durations. So when we statistically pooled all the studies that we could together, we found that boys, older children, parents with high levels of device use, and parents with high levels of stress were more likely to use tablets and smartphones for longer. I'm going to pass you over to Amy, who will tell you a bit more about Work Package 2. Thank you.
Lovely. Yes, so I'm going to speak to you all about our second work package, which aims to understand the impact of interactive electronic devices, so specifically smartphones and tablets, on the health and development of young children. So like Colette mentioned, this is a longitudinal study, so we collect data from children when they're 3, and then we meet up with them again when they're 4. And our research questions for this particular work package are, does the duration of what the children watch on their device predict later development? And can we identify a recommended duration for using these devices at this age? So it's a big study that we've got, a big work package, should I say. We are aiming to recruit 874 children. And the inclusion criteria for this study is that they're 3 years old when they first take part with us, and that they are not, they haven't been clinically diagnosed with a developmental delay from a medical professional at this point. To have a look at the measures that we're collecting, so we're interested in their exposure to devices, so how long they're using devices for, but also the content that they're accessing on these devices as well. So are they engaging in more passive screen viewing activities, or are they engaging in more kind of educational apps, things like that? We have our primary outcome that we're interested in, so these are our developmental cognitive skills. So we're interested in their executive function, their language, their numeracy, their working memory, but we're also looking at things like self-regulation and their social development as well. As part of our secondary outcomes, we're looking at things like their BMI, their levels of physical activity, sedentary behaviour, their sleep, their motor skills. We chat with parents to kind of assess their parent-child interactions, and we'll be collecting data, their school readiness data as well.
It's in the iKID ready to go, so there, that's got all the bits in ready to go. Mark, just think please, because I've...
Oh, sorry, I think someone's got their microphone on, but I can't tell who. The control variables that we'll be including in this work package include age, sex, ethnicity, maternal education, parenting style. We collect data on parents' smartphone use as well, so we have a smartphone addiction scale that we use. We collect data on their hours of childcare attendance and the presence of a screen viewing policy at the childcare setting they attend as well. So lots of data being collected, lots of things to do. And like I mentioned, we collect data of what we call baseline, so when the children are 3, and then we follow up with them again 1 year later. So the next slide is a video, which I'm hoping works with the lag that my laptop seems to have this evening. If not, we can try potentially someone else from the team sharing their screen. This video is an information video that we put together for parents. We also have one for childcare settings as well, and it introduces who we are, our study, the measures that I've all just listed out. It'll give you kind of visual connections for those. So let me know. Maybe Colette, if you can turn your mic on, or give me a nod or a shake if it's not working. Hi there. Thanks for your interest in the iKID study. This short video shows you what it's like to take part in one of our sessions. We start by talking to children about the different activities that we'll be doing and asking them if they'd like to take part. If they're happy to take part, we'll do some iPad games that look at children's skills like vocab, numeracy, memory, and impulse control. Next, we measure their height and their weight. Children also do a peg task so that we can look at their fine motor skills. We measure their hand strength with a simple grip task. Balance is checked with easy standing tasks. We see how far children can jump. And finally, there's a quick stand up and run task. Each child's also offered a special magic belt. This monitors how much they move and sleep over the course of a week. We introduce this with a superhero story and masks, and most children enjoy wearing it, but if they choose not to, that's completely fine. While one member of our team works with your child, you'll be asked to complete a few short questionnaires about your family, your child's routines, and how you use technology yourself. If your child uses a tablet or a phone, we'll help you install an app that records how long different apps are used for each day. It's completely anonymous and it's easy to remove at the end of the week. At the end of your visit, you'll receive a pack that has any additional information that you might need. Your child will go home with their mask, stickers, a reward chart, and a certificate. Once you've posted the belt back to us at the end of the week, we'll email you a £50 voucher as a thank you. You'll be invited back next year for a second session, and if you come and see us again, you'll receive another £50 voucher. We're running sessions across several venues in different locations, so you can choose a time and a place that suits you best. To book your session, head to this webpage, complete our consent form and choose your slot. A member of the team will be in touch to confirm your booking and answer any questions that you might have. We look forward to meeting you and your child soon. Thanks, Claire. I think that worked a lot better than it was working on my laptop. So the video you've just watched contains all of our measures and kind of outlines what our kind of data collection process looks like. In terms of recruitment for this work package, we have two recruitment pathways. What we started with is the route on the right, so our recruitment via early years settings. So when we first started this pathway, we were reaching out to childcare settings, so day nurseries, school nurseries, childminders, and trying to tell them about the study and asking them if they'd like to take part as a setting. Settings that do take part in our study get £100 for helping us. And one of their main kind of tasks is that they then put us in touch with the parents of the 3-year-olds within their setting and help us recruit the families to take part. So ways that we tried to reach early year settings included kind of direct contact from us. We also had local authority connections that helped act as gatekeepers for recruiting these settings. We did the social media, flyers, the posters, all the usual stuff to try and get them on board. We're in around this time last year, kind of May time, we also introduced our parent direct approach. So in this approach, parents bring the children to us for kind of a one-to-one appointment. These appointments take place in family hubs or university buildings in different areas. We've been doing these in kind of Sheffield, Doncaster, Rotherham, all over the place really. To approach parents like this, we have our social media campaigns that go on, we have our flyers, our posters, adverts like the ones you've just seen as well. But one of the most recent approaches that we've introduced is SMS messages from GP practices. So we have a bunch of GP surgeries across South and West Yorkshire that have signed up to support our research, and essentially they send a text message out to parents within their practice who have children that are 3 years old and they're eligible to take part. If you could just press the next slide, Colette. Thank you. So in terms of how we're doing with recruitment, things are going well. So from our settings approach, we've recruited 94 childcare settings and 182 children. And then with this shift, this kind of combined with the parent direct approach, we've recruited 402 children via this avenue as of this week, with 111 of those children coming to us via that SMS with GPs. So at the bottom there, you can see our kind of combined total of 585 children. Like I said before, our target is 874, so we are currently 67% towards our target sample. Thank you. And now I'll hand over to Ellie. Thank you.
Thank you. Thanks, Amy. So yeah, work package 3, we're looking at a little bit different of a part of the project. So instead of looking at a massive quantitative aspect where we're looking at loads of different children, we're looking at only 20 families, and we're wanting to understand the context and interactions of how children are using tablets and smartphones at home in a lot more sort of intricate detail and depth. So next slide, please. So what we've understood is that there are quite a few existing studies looking at the fact that children are using these devices at home. So this isn't a surprise anymore. There's plenty to sort of suggest that children are using these devices possibly more than the recommendations. And what we want to understand is trying to learn about how these children are using these devices and what context they're using these devices. And we're wanting to do observation of this by using a camera that's placed into children's homes to understand how these children are using them, so that we can influence and inform educators and policymakers. Because at the moment, the recommendations kind of contradict and sort of conflict with a lot of what parents are using the devices for. And so it's really important that we kind of reflect what real families are experiencing with these devices and how they're using them. So the research explores how the families are integrating these interactive devices into daily life, into different routines, their attitudes of these devices, and just how they're experiencing them, really. And we're aiming to get 20 participants in total. And at the moment we have 20 participants, although there might be a couple that we are struggling to get in contact with, so it's possible that we need to find another couple of more participants, but at the moment we are about 20 participants, which is really, really good news. Next slide, please. So the way that we're going about this particular research project is we're starting off with a questionnaire that's going to families, it's going to parents, and it's mostly been filled out by mums so far. And we are asking them questions about their own device usage, so asking them about their own phone and tablet usage, as well as their child's tablet usage and how long, for example, they're using them. Are they using them before they go to bed? Are they using them at set times? That sort of thing. We're also asking questions around their demographic background, so we're asking about income, we're asking about the area that they're living in, so we're looking at the postcode for the IMD, so index of multiple deprivation, as well as ethnicity and how many siblings the child might have. The second part of the research is looking at the screen time usage, so that we're actually putting a camera, as you can see on the right here, into the family's home, just to be able to sort of observe how many times the children are using these devices, in what context they're using them. Are they using them with siblings? Are they using them on their own? Are they using them whilst walking around the room or upside down? We've seen quite a few handstands whilst watching TV and quite a few sort of cartwheels while using the device. So those kind of things are quite useful to be able to observe, because there's stuff that parents possibly wouldn't think to bring up during an interview, but they're really useful for us to be able to sort of talk through them when we do go to the interview stage. So the third part of the research project is to have an interview with the parents, and this is looking at the devices and how they're using these devices, and the impacts of how what impacts how they're using these devices. So for example, mums often bring up that they use the devices for their children when they're cooking and cleaning because they know it's a safe space, as I'll go on to talk to you in a second about. But we are also including the questionnaire results and the screen time recording results. So I'm showing the families about 6 or 7 clips during the interview, and this is a really fantastic way of being able to show families exactly what we're sort of talking about and really just sort of get to the point quite quickly with them, which has been really helpful, and we've been able to get quite a lot of insightful and rich data from this process. Next slide, please. So I'm not going to be able to go through all of this in much detail, but I'm going to try my best to go through the next, the main 6 themes that we're kind of finding so far. And again, this is quite preliminary. Sorry, it's been a long day, lots of traveling. So at the moment, we've got about 9 participants that this data is based on. So we're hoping that more patterns and more themes will kind of appear and will strengthen as we kind of go through the rest of the participants. But so far, older siblings having an influence has been a huge theme. So older siblings helping younger siblings, both in terms of responsibility, helping them if they're stuck on a game, for example, but also in terms of introducing them to games and apps, which can be a bit of a challenge for the parents. So navigating that is something that a lot of parents are kind of struggling with, but also can be really beneficial for the younger child as well. We're also noticing that the younger child is more likely
to have the have a device at an earlier age than the older sibling, because it's already in the family home, and you know, the younger sibling wants to be like the older sibling and have the device. School is a huge driver of device adoption, especially if there's an older sibling in the home. The schools are often quite pushy with the devices and require them to be used at home for schoolwork and homework, which is making it quite challenging for parents. Parents are feeling quite conflicted by this, and it often increases screen time limits to beyond what the parents had previously set, and also beyond what the government has now recommended. So that's something that we want to look into a little bit further. We're also seeing that transitions to secondary school really intensify this pressure, as they're expected to use the devices. Older siblings are expected to use the devices more. And again, this is having a knock-on effect to the younger siblings with the theme above. Devices used as safety tools, structure and practical parenting. So as I was mentioning before, when parents are cooking, when they're cleaning, when they need to get something done, like hang the washing out, they will often give the device to the child, knowing that this will effectively glue the child into place for the next half an hour. And they know that they are safe. They know that they have got safety precautions on the device, and that the child's very unlikely to move around or move away from the device. So this is seen as a very safe option for parents. It also helps to create routines and compliance. So we're finding that is used a little bit as a carrot to try and get children to sort of get dressed, to have bath time, or even leave the park if they're struggling to get the child to leave the park. Next slide, please. So some other themes that we're finding is this work-family boundary strain, which again is being seen to be quite gendered. So the idea that mothers are feeling quite pulled between work and childcare role, which is exacerbated by working from home. So replying to emails, for example, is something that a lot of people are saying that they're really struggling with, especially if they're wearing a smartwatch and they're getting notifications from work, or even for a family admin. Like a lot of it's usually mums who are dealing with the family admin, so they're often having to sort of deal with school, deal with swim coaches and various people like that, and this is something that mainly mothers are having to do, and mainly mothers are finding quite a challenge, where they're being pulled between working and responding to these notifications and their childcare role. We're also seeing extended family as both a positive and negative influence on using devices. Sometimes they will buy children these devices, even when parents have asked them not to, which you can imagine is causing a little bit of tension in some households now. We're also seeing that some extended families are very anti-devices, so they're taking their grandchildren out to the park more particularly, or doing arts and crafts or something like that. So it really depends on the family around, the extended family around the kind of closer knit family, on whether they're actually using the device more or less. And again, there has been quite a few sort of contentious issues where they're purchasing the devices despite the parents asking them not to. Child temperament is a really big one as well, where parents are finding that their children are not necessarily responding to the same parental boundaries that their older sibling had previously responded to. So this idea that there's not a one-size-fits-all approach, something that worked for one sibling didn't work for the others, and so this is kind of causing a bit of an issue where parents aren't sure how to exactly manage that, and it's causing a lot of stress. Final thing that I haven't actually mentioned, so it should be 7 main themes, is TV usage. We're also seeing TV being used quite a lot, often in the background whilst devices are being used. But the biggest thing that we're seeing with that is that the TV often allows children to do other things. So they'll often play with their siblings, they'll often play with pets, they'll often do arts and crafts while the TV's on. Whereas if the device is on, they are usually more stationary. They're usually holding the device, and they're glued there for a lot longer period of time. So the TV has been quite a useful way of engaging family members, allowing people to sort of talk whilst the device is on, whilst the TV is on. And so that's quite interesting, because the recommendations from the government kind of groups devices and TVs in the same category, but actually what we're finding is that there might be a difference. So just to add that one on there. But that is all from me. So next slide, and thank you very much.
Thanks, Ellie. On to the next slide, please. I've just got a couple slides before we move into some time for questions. So we pulled out some key findings so far. Firstly, that the mobile phones and tablets use is widespread among young children, and that while these devices can support some aspects of learning, they can also have harmful effects on things like sleep, motor proficiency, and psychosocial behaviour. And then looking at, in the context of the home, that parents' use of device can negatively impact their interactions with the child, which may in turn affect children's behaviour and development. There is a strong correlation between parents' use of mobile devices and their children's use of these devices. So often where, parents who use their devices a lot have children who use devices a lot. And finally, that parental stress is a key factor in children's device use. Next slide, please. And then in terms of future directions across across our work packages, our work package 1 study, the systematic review, concluded that future interventions tackling the use of mobile phones in children should involve parents. In work package 2, we aim to address whether the duration and content of mobile device use affect children's development, and try to establish a dose-response relationship between the use of the devices and developmental outcomes. And then finally, in work package 3, we want to understand the context of how these devices are used in the home environment. And together, these work packages will help to inform education and health guidelines and develop interventions for parents and early years practitioners.
Ellie, you want to say something about this, what you have been talking with parents?
Yeah, I mean, that's a really valid point. I think that's why this part of the research project is so necessary, is because we really need to understand exactly why parents are using these devices, and that they're not small reasons. They're not just insignificant. They've just decided to one day, and they're not flippant reasons. They are valid reasons that families will often have to use these devices. And something that I didn't mention because we didn't really have time, but is the fact that often the dads are there watching on their own phones next to the kids whilst mum's cooking and cleaning. So there's a lot of burden being placed on mum, particularly, to sort of fix all of this, whereas actually that's possibly the wrong angle, and mum's doing a lot already. So I think finding ways to sort of support mums and support parents is necessary, and sort of understanding the reasons why they're actually using these devices. And it might be a case that we find that there are more educational apps that are actually suitable for individual solo usage that could be then encouraged if you do need to put the washing out. We've all been there where we have to put the washing out. We've only got, it's not like it's sunny all the time. We've got a limited amount of time to get the washing out. And so we understand that if we can find a way that supports parents, but also kind of supports the child's learning as much as possible, that's great. But yeah, I think it's a much bigger issue than just sort of saying, don't use these devices unless you're with a parent, because that's just not practical.
Yeah. And just something else I want to mention, like some of the data that we saw, that parents from low income children tend to use more the device, and also parent stress is associated with increased use. So the more the parents have on board, and the less opportunities their children have to do something else, the more they're going to spend time on the device. And the importance also of the extended families. So families that are very small, when there is quite a lot of burden on the mother, for example, they probably would give the device more often to the children because they need to take care of other things in that case. So the thing about content that Ellie mentioned, that's why we're so interested on tablets and smartphones, because it's kind of a little bit different from TV. When I was a kid, it was just TV. My mom kind of knew what I was watching, But now you give a tablet to my son, I don't know what he's watching. He's just jumping from one thing to another, and all of a sudden he's watching something that I don't want him to watch. So it's like it's challenging. It's different than it used to be. So there is new challenges for motherhood nowadays, and most of the parents feel stressed, I think, with child is, and they kind of don't know how to use, how we're going to control. Yeah, how is there is quite a lot of apps that have parent control apps that it could use. So, but I think it's an evolving area. But also there are some people that argue that could actually maybe reduce the educational gap, because give some opportunity for children to learn some of the things that they are not have access. So I think we have to just try to look to how we could use it. So yeah, it's a big area. So please, you want to say something?
Yeah, I found it fascinating, and you I'm just thinking about what you're saying around parental stress, and I was wondering if you could just unpick it a little bit more in terms of when you say you know, what kind of stress factors are parents talking about when they're saying that they're stressed? Is it some of the things you've already identified in terms of, you know, the balancing home and life, or is it circumstantial in terms of, you know, monetary worries, or could you just explain a little bit more about that?
Yeah. Colette, you want to say something, because you got this question before, isn't it, for the STEMART review, or if you're happy to go for it?
So the measures that were used to assess parental stress in these studies were around the kind of the stress within the parent-child relationship. But obviously that could involve quite a lot of things. So that could involve you know, the wider things in terms of monetary worries, employment worries, all that kind of thing. So it's the things that, yeah, it's the circumstantial things in their life that impact upon parent-child relationship.
That's really helpful.
Yeah.
And it's made me think a little more actually about the unavailability of the parent, because if the parent is stressed and it's about the relational aspect between them and their child, if the child therefore didn't have the tablet, what would, or the you know, device, what would fill that void? It's just I know that you're looking at the device, but it makes me wonder about
Yes.
regardless, an available adult at that moment wouldn't necessarily be available regardless of whether there was a device or not. So it's interesting. And then the other thing to say, which is as a grandparent who lives far away from her grandchildren, I find it really helpful. But then I think I act more as a TV. Because at the end, you know, when we're FaceTiming or WhatsApping and we're having that communication, it's a really good way for us to stay connected. But when I was having to sing Frozen down the phone the other day, you know, via some sort of, you know, microphone aspect, I think it was more entertaining than it was. Well, I don't know. I mean, their faces would suggest it might have been.
I think we are finding in work package 2 that a lot of the children are using devices for that kind of social connection. So a lot of the children are using them to communicate with wider family who aren't necessarily in the same area, look at photos of family, that kind of thing, and kind of explore those with their parents and talk about it and things. So yeah, there are uses of devices that are actually like positive and that kind of thing. Yeah.
Excellent. Thank you. That's all I had to say, but thank you.
If I could quickly just sort of add something to what you were saying there, Fliss, something that we have found with the grandparents being more present, or stay-at-home mums, or mums being available more often, is that the children are often in the situation, because we can actually see them. We can see them sort of looking around and deciding, are they going to pick up the device or are they going to speak to somebody? If somebody's there to speak to them, they will do that. I think that's usually the preference. But when they are met with a parent on a phone, or when they're met with no other adult in the room, that's when the device is actually a soother, it's a comforter, it is like a safety blanket to them that provides them with that social interaction and connection. So I think, yeah, you're right there, that having those extended family sort of situations and having available adults, whether that's parents, grandparents, is really, really important. And we're definitely seeing that that's quite a big difference, less so in terms of income, but more in terms of just the capacity that the adults in their life have.
That's really interesting, because when you think about some of the Robertson videos that were studied around attachment many, many years ago, and one in particular with a little study of John, who was separated from his parent, and actually he turned to a stuffed animal at that moment, you know, where he didn't have the availability of the adult. It's fascinating to think that children are turning to a device in that void. Thank you.
And just to add, like the thing about parent stress, and the literature showed that so the higher they stress, the more they spend time in the device separately, and said that increased a little bit more the isolation, because the parent stress that was measured in systematic review is about parent and child stress mainly. So, but they spending more time, they are more disassociated with each other, and how it's going to be the consequences in long term. So that's something that was in one of the last slides, that maybe future interventions should also look at parent stress to control screen behavior, to try to help parents, and maybe the inequalities and other things. And some points you mentioned, it can be a good thing, like it can be good, like it's the way that you connect with your grandchildren, and it's a way that you can maybe watch things together. It brings some learning resources that some children might not have access, but it's a tool that you need just know how to use. But it's really attractive tool, and kids can be very attached and very glued to it. And lots of earliest practitioners mentioned to us that it's hard to compete sometimes with a device, because nothing's so quick and so interactive, and so children are sometimes playing less and spending more time on the device because they offer more attractiveness to it. But I was talking with Emily, like there is going to be Toy Story 5 coming on cinemas, and that's the whole story about Woody being exchanged for a tablet. So, and what's going to happen next? So yeah, it is. I think the displacement of play is an important thing too, because we all know about how important is play for young children, for different characters on their development, and the fact that they're spending lots of time on the screen and playing less might affect their social development, their communication skills, their motor skills. So it's all the thing about balance that I think we need to think of. Maybe reduced to zero is not the case, but I think looking more at the content, look at co-viewing, parents being more interactive as much as they can with the children when they are around. This, I think, is more what we should focus on. Yeah.
Thank you. There is a comment in the chat. So
Yeah.
I don't know if you want me to read it out. Sarah's just written, I wonder whether parents have become de-skilled, or does the stress of modern life prevent the time and availability for the kind of involvement there was before devices, for example, cooking, washing, etc., with the child?
Like, yeah, in that qualitative study that I did before, some of the parents told us, it's easier to give the child the device because otherwise my house would be full of glitter and it's going to be a mess. But like, this is something that my parents had to deal with, although they put some time myself on the TV too, but it's part of their parenthood, isn't it? And I think because we are so attached too, we think that this is an easy thing. I know my house is going to be tidy. He's going to be quiet. He's not going to be begging or for attention. So it is I think it is related to parent skills and how our behavior on screen is influencing too. Yeah.
think we might have to end it there because we're up to our limit. However, I feel that there's a definite need to get you back. So maybe as you are pursuing your research, you might come back and share some more with us, because it's been really interesting to hear what you have to say. And you know, we're all living with and working with children and families who experience this, and you know, if we can give them the best research, the best advice, the best support, then we're giving the children the best chances that we can possibly give them. So thank you. Can I just say a huge thank you? I have really enjoyed it and loved the interactive conversations at the end of it. So thanks everybody for your participation.